Assalamu alaikum. Thank you for this selection committee for this award and choosing this paper. This was very interesting paper based on the hematologist experience in the clinic, and they have come across with the patients coming with the neutropenia. However, they are normal and they don't have any conditions on board, so we came up with this paper. So the title of the paper was Hematological Indices in the Adult Saudi Population, Reference Intervals by Gender, Age, and Regions. Quickly, the usual outlines. The paper was published in the Frontiers in Medicine under Hematology section, Impact Factor 5.5, which is indexed as well. So a little bit about introduction. The complete blood count is a widely used lab test to assess the individual disease status and the follow-up for the disease management and the monitoring. Each laboratory have their own reference parameters for interpretation of the CBC results. There are a list of the factors which impact the CBC parameters like gender and age, ethnicity, genetics, environmental, lifestyle, nutrition, geographical location. So the aim of our project was to provide the hematological parameters for the adult Saudi population to estimate the prevalence of the common abnormalities. And we have conducted the study in the 3 regions, all the 3 branches in our 3 regions of NGHA for the sample of 1,388, both male and female Saudi employees who came for screening over the 5 years between 2015 and 2019. Their age range was from 18 to 55 years. The data was collected from the best care. The variables collected were the age, gender, and the regions apart from the CBC. CBC were reported as the mean and the 95% confidence interval as well as the 95th percentiles. The comparison was made using Wilcoxon. The blood count abnormalities were defined based on the reference ranges of our hospital. Leukopenia was considered when WBC was less than 4. Neutrophils less than 2 were considered as neutropenia. RBC more than 5.4 were considered as polycythemia. So coming quickly to the results, 54% were males. Majority was from the central region. Their mean age was 30 years. The distribution of the age, 55% were younger age group, 18 to 29 years. 16% were smokers, mainly were males. Comparison by gender, the differences were observed for the hemoglobin and platelets. The RBC hemoglobin was higher in males while the platelets were higher in females. When we compared the parameters by age categories, RBC hemoglobin were higher in the age category of 30 to 39 while the platelets were higher at the age of the 40, which is a normal physiological changes. When we compared across the regions, the eastern region had the lowest hemoglobin and the RBC as well as platelets, and we are all aware because of the genetic elements involved. Now, the rate of anemia was statistically different by regions. The overall neutropenia was 13%, which is more or less similar reported to the studies in the region and the country. Anemia was more predominant in females. Polycythemia was predominant in males. Limitation of our study, we could not capture the comorbidities since it was a retrospective study, and we also could not capture the time of the sample collection, exposure to the occupational exposure, drugs. These information could not be collected. Secondly, the employees from the different regions are case mix, so they're not mutually exclusive. So they belong to one region, but they are residing in another region. The results may not be represented to the other age groups, elderly, children, or adolescents. Conclusion from the study is the current parameters are based on the Western population, so we recommend to have reference intervals based in Saudi population. Now, gender and age differences were observed. Anemia was more prominent as mentioned in the female and the eastern region. Rate of benign neutropenia was similar to the other studies. The impact on the healthcare. So most important thing to consider when the clinicians see a patient in the clinic while interpreting CBC, so when they need to have a further diagnostic workup, so not to miss a disease or not to have overwork. So this is the most important impact on the clinical healthcare. Just a quick acknowledgements to Dr. Alaskar, Dr. Omar Dibasi, biostatistics team, especially Maram, Ms. Abir, and my family and friends. Thank you.